Hi, my name is Brittany Cannon, and today we're going to be discussing whether or not art and music therapies should be covered under health insurance. Now, art and music therapy are just as scientifically beneficial as any other therapy method that is actually covered under health insurance. And as we see our society begin to move toward being more creative, we also see that creative therapies are growing in popularity. These therapies tend to be coordinated with doctors who are seeking to improve your quality of life and mental health, just as any other therapy is. The arts are a way for anyone to find a way to express how they're feeling without having a fear of being told that they're doing it wrong, because there's no way you can do what you're being creative at wrong. But what many don't understand is that creative therapy is not covered by health insurance, and that is because it's considered an alternative method and not one of the traditional methods. And today we're going to explore some of the key ways that creative therapies are just as beneficial as traditional methods. And the first thing that we need to realize is that there are different methods of creative therapies that target different responses out of the patient. Healthcare.org says that art therapy combines visual and tactile experiences with psychotherapy. You determine the medium, complexity, and style of your artwork while speaking to your therapist. So art therapy is when you draw a piece of artwork and it depicts what you are feeling, and then you are able to kind of dive into what that piece of artwork that you just created means to you and how it symbolizes how you're feeling, what you're going through to your therapist, rather than just using words. Music therapy, on the other hand, includes a variety of exposure to music and sounds. It works to evoke emotion and memories in patients as they respond to what they hear. So they hear a piece of music and the therapist says, "What do you think of when you hear this piece of music?" And they tell them exactly how it makes them feel. Creative therapy reduces anxiety and stress in individuals because their creative outlet is what soothes them. So if I like to sing or I like to listen to music, music therapy is what's going to make me feel most comfortable when talking about my feelings. If I like art more, drawing or creating something that makes what I'm feeling actually in front of me is what's going to make me feel best. Second is that creative therapies bridge the gap between art and health. The U.S. National Library of Medicine says creative expression as a healing process promotes wellness and healing in both clinical and informal practice. We are able to see where art and health are going hand in hand to not only make the patient feel like they are comfortable with their therapist, but also find a way that their creative outlet can soothe them and help them to recover. Music has placed principal emphasis on soothing capacity of music and its ability to offset overly technological approaches to care. And this picture that I am about to show shows the effect that music has on your brain. It shows all of the different sides of your brain and how music specifically can make you feel. This is the picture that I was just talking about. It shows how music has the ability to alter the breathing and heart rate. It can help reduce the perception of pain. It can alter the patterns of pain, depression, and disability. And it can occupy the mind with something familiar and soothing. Instead of having a piece of you that is trying to recover always, you are able to use music to see how it can alter how you see that experience. And creative therapies are proven to reduce anxieties, calm neural activity in the brain, and better the immune system. So as you are diving into whatever it is that you most like, specifically talking about the arts, you are able to become better all around because you are doing what you like, and it is what soothes you most. And lastly, we can see that art can produce a powerful release of feelings that can be healing to the mind, body, and spirit. Through socialization and creating, those participating in creative therapy find that they are able to cope with whatever it is that they're going through, whether it's stress, loss, or a certain type of disease, better because they're able to enjoy what they're doing. And like I said, when you're able to do something that you like, while also finding how you can heal from whatever you're going through, you're able to enjoy it better. And this picture that I'm about to show you is how music can help people who have autism, and it is able to give them a way to focus better or to increase their cognitive thinking. So here's the picture that I am talking about. And it shows how music in general, only about 1% of the world's population has it, but it is the fastest growing disorder. And music helps because they are able to increase the cognitive thinking, like I said, and it is able to reduce pain and anxiety in as many as 50 patients. And it's a way for them to be able to communicate non-verbally, but also still relate to each other and the people around them. So that is super important. And because the arts are so relaxing and comforting to many, we see positive changes in the patient's moods. So we see them being more happy and having a go-lucky outlook on life. Now, creative therapies are extremely important to many who choose to not use traditional therapy options. And through much research, I have found that it is equal and possibly greater in the results that are positive when studying how these types of therapies affect the patients. And due to the fact that it is widely used, it should be covered by healthcare because it is just as beneficial as any other therapy is.